The latest news, updates, and more from the world of health and medicine. This is Medical Minutes.
About International Men's Health Week, the CDC says that men in the U.S. die on average nearly 6 years earlier than women. Men are also at higher risk for contracting heart disease, lung cancer, HIV, and committing suicide. And the CDC also says that men will also be more likely to smoke, drink more alcohol, and delay regular medical checkups. And so that means it's time for our morning checkup with Wish TV medical expert Dr. Janel Gordon. Dr. J, I always love it when you stop by, and this in particular is important because it's a loaded topic like we were talking about off camera.
Sure, so a lot to cover. As you said, we know that men oftentimes are missing their regular checkups, so we want to be sure that you all are going to see your physician, nurse practitioner, or physician assistant and getting those health screenings. Specifically, it's also Men's Mental Health Month, so make sure that you're talking to your doctor about any concerns for depression, anxiety. We want to make sure that you're getting your sexual health screenings as well as colon cancer screening.
So let's go ahead and dive right into this topic. What do we need to be talking about with our doctors if we need to be looking at all of these things?
Sure. So when it comes to concerns about your mental health, some individuals, and men specifically, may not realize that they may have underlying depression. So if you find yourself being more irritable, having difficulty concentrating, not sleeping as well, you notice, hey, when you go out with the guys, you're drinking a little more than usual, or you find yourself partaking in substance abuses like street drugs, then those are signs that you want to discuss with your physician. And don't feel ashamed. We're not here to judge. We're simply here to help.
Now, this part is particularly, it's going to get a lot of attention when you're talking about your sexual health. What should a man be talking about to his doctor?
Yes, so anytime you have a new partner, we want to make sure that you are being screened. In addition to that, if you have the same partner, we recommend annual screening. If you find yourself having a bump down below, any itching, burning with urination, make sure you see your doctor. For our older gentlemen, if you find that you're having difficulty urinating, don't hesitate to let us know. You may need further evaluation of your prostate.
And when it comes to, how health can affect the approach of alcohol, obviously you mentioned earlier if you're having too much to drink when you're out with your friends, or if you're just leaning into substances to kind of numb a little bit, how do you approach that with your doctor? Because like you said before, doctors are there to help and not judge.
Sure. So again, we will screen for alcohol use disorder. So don't feel like we're judging you. Again, simply here to help. So just let us know how many drinks you're drinking regularly. We used to be able to say men could drink about 2 drinks per day added up over the week, and no more to about 4 to 5 in one setting. Now, with the latest research coming out when it comes to cognition and memory, we're really not able to still give that recommendation. There are benefits for the heart if you're not drinking in excess. If you are, it's increasing your risk for heart disease such as heart failure, liver cirrhosis, liver cancer, and colon cancer as well.
Now, we're also going to touch on something that I think a lot of guys at home are going to say, it's not, that's not important, but people are reluctant to go to the doctor. It's not just, you may be feeling all right, you're healthy, don't go. You need to go anyway. So how do you persuade the people that are pushing back saying, I'm fine, I don't need the doctor, to say, hey, just go get checked anyway if you're all right. Just get some confirmation.
Yes, so sometimes we don't realize how our age, our ethnicity, our lifestyle can affect our risk factors. So if you're having a conversation with someone who you trust, just talk to them and then see, hey, could you maybe schedule that appointment for me? Oftentimes we'll have wives or partners, children calling to schedule visits for the men in their life. Also, for those of us who do have special men in our life, be it a father, a partner, a son, go ahead and encourage them to schedule the visit, cook them a healthy meal and say, hey, let's go get active and take a walk together.
I like that. Persuasion. It always
just a little bit, Jeremy.
Well, especially when you're talking food. The food is a way to a man's heart. That's what they say.
Yes. And remember, we want to make sure that we're always eating the rainbow.
Wait, always eating the rainbow?
Yes, Jeremy. So make sure you've got lots of bright, different types of fruits and vegetables on your plate. Make sure you're eating lean protein. We do want to make sure we have some fat in there also, whole grains. And the best beverage, Jeremy? Water. Okay.
Now, see, I work with her. And I learned something new today. The rainbow, always getting a nice, colorful plate. Dr. J, thank you for stopping by. This has been a very informative segment.
This is the Medical Minutes Podcast.